Hi, my name is Jackie Wagner. I'm an NTC nursing student, and today I'm going to show you how to change a central line dressing, in particular a PICC line today. So first and foremost, I'm going to check my patient's order. I have Bob Owens, date of birth 9/22/33, and it does look like we have an order to change the dressing. So we will gather all the supplies for that. First, I'm going to make sure that he doesn't have any allergies. Looks like he has an allergy to morphine, however, we will not be using that today, but I am going to ensure when we get in the room with Mr. Owens that he does not have any allergies to tape or any antiseptics that we might be using. So once we have verified the chart, the order, and the allergies, we're going to make sure that we have everything that we're going to need. So I have my sterile cup, I have a mask for Mr. Owens, I have my swabs, 2 pairs of clean gloves, some hand sanitizer, some normal saline, which is not expired, a measuring tape, and my sterile central line dressing kit. So once I have everything that I need, I'm going to introduce myself to Mr. Owens. Knock, knock, knock. Good morning, Mr. Owens. My name is Jackie. I'm going to be your nurse today. I'm going to allow for some privacy. I'm going to wash my hands. So Mr. Owens, can you tell me your name and date of birth? And so he says Bob Owens, date of birth 9/22/33, and that does match my chart. Bob Owens, date of birth 9/22/33. So Mr. Owens, it shows that you have an allergy to morphine. Do you have any allergies to any tape or antiseptics that we might be using today? And he says no, which is good. So have you had your PICC line dressing changed since they've put it in? And he says yes. And so just to remind you, I'm going to be placing a mask on you to keep our sterile field, and he says he's okay with that. If he were unable to tolerate the mask, I would instruct him to face the other way to make sure that he is not coughing or breathing on our insertion site or our sterile field. But he is able to tolerate it. I'm going to ask some additional questions to make sure that he is competent, able to follow commands, and able to understand the procedure, and he is. If we were to have an elderly patient with dementia or a younger child, we may need additional staff to help with this procedure. But I am confident that Mr. Owens will be able to hold still for this procedure. So, to get us started, I'm going to wash my hands again. I'm going to measure their circumference of the arm above the PICC line. We want to make sure that there's no swelling or redness above the insertion site. So we're going to go from the insertion site up 6 inches, and at 6 inches we're going to measure the circumference in centimeters. And once we have that measurement, I'm going to write it down on a piece of paper so I remember that, that length when we have to document it later. Then I'm going to go from the insertion site, and we're going to measure from the hub. And so we want to make sure that we write that down as well. If the length from the insertion site to the hub is more than ½ an inch off, we're going to want to make sure that the PICC line is still placed where it's supposed to be, and that that is still patent. So we wouldn't do anything until we can verify the placement of that PICC line. So once we have that and we know that the PICC line is where it's supposed to be, the patient doesn't complain of any pain or anything like that, I'm going to wash my hands. I'm going to place the mask on Mr. Owens. Are you ready for your mask? And he says he is, so we're going to place that on him. I'm going to make sure my garbage can is where I want it to be. Get some of my sterile stuff ready. Once again, I'm checking the normal saline expiration date. It is not expired. So we're going to pour that, flip it off to the side. I'm going to grab my swabs. I'm going to open it away from me. We're just going to let that sit there for a bit. So I'm going to wash my hands. I'm going to open up my sterile kit, and I want to make sure that I'm opening it away from me. Now, the first time that I opened this, I did rip it. in the future, if I were to rip the sterile kit, I would grab another one and completely start over. So we're gonna open this, maintaining a sterile field. I'm gonna grab my mask and I'm gonna put that on. I'm gonna wash my hands. I'm gonna put my clean gloves on to remove the dressing. And while I am getting my clean gloves on, I'm gonna kind of look through that transparent film and I'm gonna see if I notice any redness or drainage underneath. And I'm not noticing anything right now. And so once I have my clean gloves on, I'm going to ask the patient if there's any pain, and he says no. I'm gonna take the dressing off from the outside and work my way in. If this were an elderly patient or a patient with frail skin, I'm going to be extra careful to make sure that I don't give them any skin tears. I want to make sure that I'm holding on to my insertion site above the dressing to ensure that it doesn't pull out. There should be security measures in place, but we just want to double check. Once the dressing's off, I cannot touch the insertion site at all. So, like I said, I'm moving from the outside in. All right, so once my dressing's off, I'm gonna be looking at the arm for RETA, which is redness, edema, ecchymosis, drainage, and approximation. And I'm not really noticing anything at all. If there were drainage, I'm gonna be looking at the dressing for COCA, which is color, odor, consistency, and amount. And so, like I said, I'm not really noticing anything. So we're gonna dispose of that. If there was any RETA or COCA, we would write that down so we can document it at the time. So at this time, I'm going to be washing my hands. I'm gonna put my sterile gloves on and we're gonna clean the area. I'm gonna put that right there. Wash my hands. Open up my sterile gloves. I'm going to make sure that it's not ripped and that it's intact. So once we have our sterile gloves on, we're going to make sure that our hands stay above waist level. That's why my table is so high. I am going to go into my sterile kit and grab some forceps. And the forceps are going to make sure that I maintain a sterile field, holding the PICC line up while I am cleaning. So I'm going to take the forceps, hold it up. I'm going to take my first alcohol swab, and I'm going from the inside, and we're just kind of cleaning off any dried blood or drainage that's come out. And we're going to dispose. Second one's going to go on the outside. We are using an aseptic technique. I'm going to get rid of that. Once we're done with that, I'm going to take my chlorhexidine swab, and this is going to be per facility protocol. I'm going to snap that until I hear it. I'm going to wait for the chlorhexidine to come down, and I'm going to scrub in a back and forth motion to produce friction. And so I'm going to go on each side about 30 seconds. So we're going to scrub 30 seconds, 30 seconds, 30 seconds, 30 seconds. And then we're going to dispose of that. So once we have that, we're going to let it air dry. Once it's air dried, we're going to apply some adhesive to the skin, and we're also going to let that completely dry before we put the dressing on, because we want to make sure that there's no skin irritation. So while that's waiting there, I could take my sterile gloves off, but for convenience, I'm gonna keep them on because we're gonna be using a no-touch technique from here on out. And so once that is completely dry, the adhesive is completely dry, I'm going to be taking my dressing, I'm gonna be opening it, making sure not to touch anything but the outsides. And we're gonna be placing it on the patient. And on the Tegaderm, there is a location where I can write my initials, today's date, the time, and so I will be using that as my additional tape to secure it. And so once I have that done, I can take my gloves off, wash my hands. Some facility protocols may have a betadine circle right there. I'm going to take Mr. Owen's mask off. I'm going to take my mask off. I'm going to wash my hands again. I'm going to dispose of all the equipment in the appropriate location. And then I'm going to open up the privacy screen, make sure that his bed is down as low as it can go, make sure the call light's on him and that he's comfortable and doesn't need anything. And then I'm going to document the dressing change, the location, any Rita or Coca that I've observed, any measurements that I measured before I did the dressing change, and I'm done.